And a management row within the Kenya National Union of Nurses is threatening the operations of the vocal trade union. KNUN leaders are now demanding free and fair elections to pick a new office as relations with Secretary General Seth Panyako continue to soar. Panyako has reportedly gone missing days after a professional gaffe, as Anita Nkonge now tells us.
You are a persona non grata. Non grata.
This clip, that we cannot show in its entirety due to breach of patient-doctor privilege, would be the straw that broke the camel's back. The Kenya National Union of Nurses Secretary General Seth Panyako sharing in public medical records of a patient. Union members have distanced themselves from the remarks and are now calling for streamlining of operations.
Our members are out there in their homes, not sure of whether they'll secure their jobs tomorrow because of a strike notice that was issued by the Secretary General of our union, Mr. Seth Panyako. And now he's going into hiding. They're asking Panyako to come back. If he can't call off the strike, he let him come back and tell nurses the way forward on this issue of the strike.
The nurses now want union elections in line with directive last year that directed all trade unions to begin formalizing mechanisms for an election in 2021. In ensuring transparency, the Medicare providers are demanding a list of the Electoral Board members conducting the polls and their credentials, and an audit report covering the last 7 years, amongst other requirements. Not only are nurses dealing with rifts within the union, but it would seem that they're living in a tale of two Kenyas, as the nurses call out what they say is the unfair distribution of funds. This coming in the middle of a strike in which the nurses have raised safety and welfare concerns.
We want to be served equally. Doctors have been paid more risk allowance. Clinical officers the other day were awarded the same. And nurses have not been given. Who is at risk more than the other?
And the fact that MCAs are getting a car grant is not helping, sparking fears that it may spark more requests from different public sectors.
These recoveries that you're having, is it the MCAs that are making the Kenyans recover? It's not the MCAs. It's the health workers. And yet, you cannot give them something very small that they have asked for. We condemn SRC in the strongest terms possible.
Nurses have stayed away from duty for close to 3 months now. Anita Nkonge, NTV.